Women below the age of 40 may get symptoms which mimic menopause. For example, irregular periods which take a long time to come and then disappear, hot flashes, night sweats, irritability, vaginal dryness, weakening of bones due to lack of enough estrogen, and low libido. The most likely diagnosis is that the ovaries are not working at all. That means that such a person may have premature ovarian failure.
When your ovaries do not do what they are supposed to do. The ovaries are supposed to do two things: to produce the eggs and to produce the hormone.
It may then be difficult for one to conceive as a young person.
In most cases of premature ovarian failure, fertility is inhibited. They cannot conceive because they are not making the eggs are not maturing, or they are fighting against their own eggs. For those ones, we have to do a lot of counseling.
The cause for ovarian failure is unknown. There are some factors, though, that may increase the risk of ovaries failing.
If you are on chemotherapy, cancer treatment, or radiotherapy of the pelvis, your pelvis is radiated, okay, then the chances of destroying the ovarian cells is very high. And actually in those cases, the failure is usually almost permanent.
A woman who smokes also has a higher risk of her ovarian failure. Smoking often augments with other existing problems that may cause premature ovarian failure.
You know, smoking really poisons many parts of the body. So as younger and younger women take up smoking, we see more cases.
Exposure to chemicals like pesticides for a long period of time, working in the X-ray department, exposed to X-ray radiations without protective gear, may also increase the risk of premature ovarian failure.
Only that in premature ovarian failure, in rare cases, they still get pregnant. Very, very rare, maybe 5% of cases, because you may just get that one egg that may bypass all those barriers.
Premature ovarian failure is genetic.
It's important for women to know their body, to understand their body, to go for checkups, not to think that this thing is just maybe stress, or, you know, when you miss your period for 6 months, 7 months, have it checked. The thing we usually have is that women take a long time before coming for a checkup.
There is no treatment for premature ovarian failure.
We cannot return an egg when it is not there. Most of the treatment is symptomatic because the ovary has failed. For a young lady, it is important that the functions of estrogen are maintained in your body. And most of the time, the estrogen levels are low. So for these patients, we would give them hormone replacement therapy. And it would be very useful for them.
A woman should have 2 specific X chromosomes. If one lacks or gets lost somewhere in development, a woman may end up with X and O chromosomes. That means the woman has Turner's syndrome. She will not have her menstrual cycle and may get ovarian failure at a younger age. This type can be detected easily as she has not developed secondary characteristics associated with estrogen. A DNA test can determine whether there is a missing X chromosome. Zipporah Karani, KTN for Health Digest.